So these are my disclosures. They're not obviously relevant to this talk. So why are we talking about biomechanics of the shoulder? What's the purpose of this? Well, obviously we want to have guys that are going to throw like this. We want to try to mitigate risk for shoulder and elbow injury while we do this. And so if you think about the shoulder complex, most people in this room understand this. It's made up of 4 separate joints, right? We focus a lot on the glenohumeral joint. And those of us that take care of a lot of baseball players focus a lot on the scapulothoracic joint as well. Just remember, there's still the AC and the SC joint, and these can sometimes pop up in our guys from time to time as being symptomatic. The reason I bring up the shoulder blade is because if you think of the shoulder blade, it's kind of the foundation for the shoulder. And if the shoulder blade is in a bad position, it tends to stress the shoulder in ways that it's not meant to be stressed. So if you look at this study from Terry Mahata, what they did was they took a bunch of cadavers, okay, and then they changed the position of the cadaver and they looked at how much stress went through the shoulder. So this was their kind of potted setup for this. And what they found was that as you increase the amount of scapular internal rotation more than 5 degrees, you significantly decrease the amount of external rotation that the shoulder has. Well, why is that relevant in baseball? Well, obviously we want to get maximum external rotation to be able to throw a pitch. So if you're sitting tipped forward, you have to put a lot more stress through the shoulder in order to get to the same amount of external rotation that you would if your shoulder blade was in a better position. So just remember, when we harp on focusing on the shoulder blade and all of our PTs are focused on the shoulder blade, this is why. It's because the better position the shoulder blade is in, the less stress the shoulder sees. Now, certainly I'm going to go through the pitching cycle with you from kind of cycle to cycle and see what's active at different cycles and when you could potentially see some injuries. So if you think about the windup phase, this is really initial movement to when their knee hits their max flexion, okay? So the max knee flexion height. And there's not much going on with the upper extremity here. You get a little bit of work in the upper trapezius and some of the serratus, but from a shoulder perspective, there isn't much to worry about here. Then we get into our early cocking phase, and that goes from that max knee flexion height to when their front foot hits the ground, okay? And when you think about here, you get that shoulder into that semi-cocked position. You're not in max ER yet, but you're coming abducted, slightly externally rotated. And what you see is that the supraspinatus and deltoid really work together to bring the arm up. And if you have an insufficient amount of, or an insufficient or kind of an excessive amount of external rotation here, you can actually get increased stress on the shoulder and elbow. And if you look at patterning as far as when their front foot hits the ground, where their pelvis is sitting, where their shoulder is sitting, we've come up with this term called a laid arm. And what that basically means is that you don't have enough external rotation in your shoulder when your front foot hits the ground. And so sometimes if we can fix that by changing their stride length around, but if you don't get that max ER, then you start to stress things further down the chain a little bit. If you take a look at trunk tilt, I kind of mentioned that pelvic position when the front foot hit the ground. Trunk tilt, pelvic position actually plays a lot into how much stress goes further down because everything's a kinetic chain, right? The forces are getting brought up from the ground. And so if anything in your chain of events or your sequence of events is not accurate or not in time or in phase, you'll wind up seeing further stress down the road. So this is a good study taking a look at trunk tilt that was done out of HSS. And what they found was that high school versus professional pitchers had a little different trunk tilt. So this is how they measured it. Positive trunk tilt was towards your throwing arm, negative trunk tilt's away from your throwing arm. And basically, the better ipsilateral trunk tilt, tilting toward the sides you're throwing, the less stress you wound up having on your shoulder. So professional pitchers are better at this than high school pitchers, and this is just a matter of correcting pitching mechanics as people go throughout time. And then if you look at throwing injuries just based on, kind of mechanics in younger players, the trunk tilt comes up again. And honestly, if you have bad pelvic rotation or trunk rotation or kids, and a lot of us will see this when we see kids in the office, their core strength is weak. We see that their trunk is not where it needs to be. You'll see them wind up with kind of internal impingement in the shoulder, little league or shoulder will pop up on them. And if you can correct some of these core muscle issues and these trunk tilt issues, these oftentimes tend to work themselves out. So let me get into the late cocking phase, right? Because now your pelvis is set. Now we're getting into that front foot contact to your max external rotation. This is when we see the most stress that tends to go through the shoulder, this in the early acceleration phase. And we see the infraspinatus and the teres minor that are having their peak amount of muscle activation here because they're externally rotating the arm, right? The subscap has to kind of eccentrically contract to keep the kind of ball center within the socket. And then the scapula goes into that retraction position. So if it doesn't get into that retracted position, again, you have to put more stress to the shoulder to generate the amount of external rotation that you need to throw. This kind of gets into that point of making sure the shoulder blade works properly. The other thing that comes into play, and I talk a lot about shoulder rotation, is some of this is a soft tissue issue, but some of this is a bony issue. And we've started to learn this a little bit more recently. And obviously, Schick and some other people in this room have done some work on this. When you're born, the humerus is very retroverted, and it undergoes this process of derotation as you get older because of some of the forces that get placed on it. And if you start to throw at an earlier age, you wind up counteracting those derotational forces because throwing favors external rotation, which favors retroversion. And so people who tend to start throwing at an earlier age tend to have more humeral retroversion. What does that do? It gives them better external rotation, but also can sometimes decrease the amount of internal rotation that they have. So when we measure the soft tissue balance in the office of the total arc of motion of their shoulder, sometimes we'll see guys that have a tremendous amount of external rotation, have kind of crummy internal rotation. And that's why we've started to move away necessarily from just the internal rotation deficit in the shoulder, and we started to move more towards total arc of motion. Because we know that there's some bony adaptations that happen. And if you just focus on the amount of internal rotation that they have, you're probably missing what's going on with their soft tissues. And so that's one of the things that we have started to move on towards is, okay, focus on their total arc of motion, not so much just their internal rotation. This is just a study out of Japan to show you that in kids, when they measured their retroversion of their throwing versus non-throwing arms, in their non-throwing arm, they continued to derotate or become less retroverted. In their throwing arms, they became, or they stayed more retroverted. So this was just a side-to-side difference. This just illustrates what I was telling you is that if you start to throw at an earlier age, you start to make some bony changes that happen in the arm when you do this. When we look at kind of humeral torsion in our baseball players, this is, again, as I was telling you, was a Schick study. They were looking at basically CT scans of professional pitchers, and they looked at injured versus uninjured players. And what they found was among the injured players, there were more days missed that were correlated to maybe lower degrees of dominant humeral torsion, meaning less torsion, less external rotation. So decreased total arc of motion, decreased external rotation. So it gets to the same point. I just want you to think about it's not always just a soft tissue problem. Sometimes it's a bony adaptive problem that goes at it at the same time. This gets into, again, the range of motion deficits with younger kids and looking at potentially elbow pain or injuries. And what they found was that internal rotation deficit was present in a lot of these players that got injured, but also total arc of motion was also present in these players. So if you're thinking about how to prevent injury in younger players, certainly trunk and core rotation, very, very important. Shoulder rotation, very important. Scapular position, very important, because all these things have to work together to try to decrease the amount of risk of injury in these players. The other thing that you should mention is when we're measuring rotation in the shoulder, sometimes the position of your forearm can change this. So if you're somebody who's going to measure this in a lot of players, just make sure you do it consistently from player to player. So your forearm rotation can actually change how much external rotation you get on your exam. There can be a 10 to 12 degree difference in this, which is pretty significant. So just make sure that however you're going to measure it, you measure it the same way every time, so that you be consistent across the people that you treat. Then, of course, we have the acceleration phase, which is kind of our most explosive phase. When we start to see rapid shoulder internal rotation, you get a tremendous amount of stress that goes through the shoulder and elbow at this point. And really, this is a lat and subscapular very active during here, and the scapula starts to protract here. And then we get to the deceleration phase. And the purpose of the deceleration phase is to prevent your arm from getting thrown off your body. So what happens is muscles contract to keep the ball centered. Potentially the biceps does some work here, but really the posterior capsule sees a lot of stress here. So the posterior capsule, this is when it starts to become thickened and less elastic because it's trying to decelerate the arm. So as guys go through the deceleration phase, this is when you start to see that thickening of the posterior capsule, which then leads to a decrease in rotation. But this is the phase that tends to cause that. So when we're talking about making sure that we stretch out that posterior capsule, this is the reason that it gets tight, because it starts to see a lot of stress as it tries to decelerate the arm. And I mentioned the biceps trying to help, maybe potentially eccentrically contract, try to help to decelerate the arm as well. We're not really sure what the biceps does from a throwing perspective. There's lots of studies out there. They tend to find lots of different things. This is a biomechanical study that was done many years ago. And basically what they found was in their model that when the biceps contracted, because they just made a little contraption here to pretend like the biceps was contracting, so they pulled on it, they found that the amount of translation of the humeral head was decreased. So potentially the biceps was helping to keep the humeral head centered. And we potentially see this when we look at some of the results of our biceps tenodesis in our professional pitchers. You know, when we initially looked at this year's back, we didn't see great results in players, in pitchers specifically that had a biceps tenodesis. The return to play rate was pretty low, it was about 17%. We updated it with potentially some newer techniques, maybe doing a little less in the shoulder outside of the biceps. So maybe not repairing labrums, not fixing rotator cuffs and debriding things and just getting out with just the biceps. And we found that there was a little better return to sport rate, but it was still at about 50%. So the biceps probably does something in the shoulder, but we're not 100% sure exactly what it does. And we tend to take it a lot in throwers. We try to avoid it if we can, because it probably has some relevance for the throwing cycle. And then of course the follow through, this is really just going from max internal rotation to when your body stops moving, you get into your fielding position. And there really isn't much from the shoulder here. So think about leg cocking, acceleration and deceleration, how they stress the shoulder, how they stress the elbow. Those are our main phases that we want to think about. And certainly from a how to prevent injury perspective, you want to optimize shoulder rotation. You want to maximize core strength. You want to maximize trunk rotation. And then you want to make sure guys stay in phase. So that way you're not dealing with a late arm. And so that's stressing things that go down the road. Thank you.